So now we're going to start the pericardium, and next topic, the external features of the heart. Now pericardium. Now, what is pericardium? The pericardium is nothing but it is the fibrous serous sac. It is fibrous and serous sac. Okay, so it is made up of two layers, the fibrous layer and the serous layer. Now the fibrous layer, it is nothing but a pouch in which the heart is present. So imagine this is the heart tube. Okay, this is the heart tube. Now the fibrous layer, it is present like this. It is the fibrous layer. That means heart is present inside the fibrous layer. So heart is intrafibrous. Now the serous layer. See, serous layer, it is made up of two layers. What are those? Parietal layer and visceral layer. Okay. So now you see the reflections of the serous layer. The inner one is called visceral layer. I am writing as V. And the outer layer, it is called parietal layer. Now see the diagram. Heart is not completely enclosed by serous layer. So heart is extra serous. So heart is extra serous. Is that clear? So now this itself a question. Heart is intrafibrous and extra serous. Clear? Now this is a basic idea about the fibrous layer and the serous layer. Now we're going to see in detail about these two layers, fibrous layer and the serous layer. Clear? Now first one, we're going to see the fibrous layer. Now we're going to draw one diagram. Now this is our heart. This line diagram. Now here we have superior vena cava. Right. Now I told you the fibrous layer. This is the fibrous layer. A fibrous layer will be like this. So fibrous layer is completely enclosing the heart tube, heart. Right. Now the fibrous layer, which is coming from the origin of the fibrous layer. Fibrous layer is coming from septum transversum. Fibrous layer is coming from septum transversum. The septum transversum gives rise to so many structures. The septum transversum also gives contribution for the formation of the central tendon of diaphragm. So now this is the base. This is the base. Now the base of the fibrous layer is fusing with central tendon of diaphragm, which is fusing with the central tendon of diaphragm. Clear? Why, sir? Because developmentally they are coming from same origin. Now what about the apex? Now the apex of the fibrous layer is fusing with the external coat of the great vessels. The apex of the fibrous layer is fused with the external coat of the great vessels. Okay, right. That is about the fibrous layer. Next, our serous layer. That's all about the fibrous layer. Very few points are there. Next, our serous layer. I told you the serous layer is having two layers, the parietal layer and the visceral layer. Now the parietal layer is very close to, see here, the parietal layer is very close to the fibrous pericardium. Fine. And along the root of great vessels, which is reflecting and form the visceral layer. Now see the visceral layer. The visceral layer is very close to, yes, the myocardium of the heart. Visceral layer is very close to the myocardium of the heart. Clear? So now this is the parietal layer and this is the visceral layer. Okay? Right. So serous layer is having two layers, parietal and visceral. Now we're going to write the difference between these two layers. Very few points are there. We write the difference. So now the parietal layer of the serous pericardium and the visceral layer. So first point, origin. The parietal layer is coming from, I told you in the general embryology module itself, the parietal layer of any body cavity is coming from the somatic layer of lateral mesoderm. I hope you remember. It is coming from the somatic layer of lateral mesoderm. Okay, right. Now what about the visceral layer? See, visceral layer is coming from? Yes, very good. The splanchnopluric layer of lateral mesoderm is coming from splanchnopluric layer of lateral mesoderm. Splanchnopluric layer of lateral mesoderm. Okay, right. Next point. The parietal layer, it is adherent to parietal layer, which is adherent to fibrous pericardium. Fibrous pericardium. Whereas the visceral layer is adherent to myocardium of the heart, which is adherent to myocardium of the heart. Myocardium of the heart. Next point, nerve supply. Now, what is the nerve supply of these two layers, sir? Now, the parietal layer and the fibrous layer supplied by phrenic nerve. Phrenic nerve supply the fibrous layer and also the parietal layer of serous pericardium. Okay, right. Now, what about the visceral layer? The visceral layer is supplied by autonomic nervous system, which is very close to heart. I told you, which is very close to myocardium of the heart. So it get the nerve supply from the heart only. So autonomic nervous system supply the visceral layer of the serous pericardium. Next one. Now last point. Now the parietal layer is supplied by phrenic nerve. Phrenic nerve is a somatic nerve. So the parietal layer is pain sensitive. Whereas autonomic nervous system supplying the visceral layer, so it is insensitive to pain, which is insensitive to pain. So these are the basic difference between these two layers. Okay, right. If you know this, more than sufficient. Now in the exams, the questions are usually coming from the sinus, the space in the pericardium. We see that. Now before we see the diagram. Now in this diagram, yes, we are seeing the two layers of the serous pericardium. Now again, outer layer will be fibrous. So we'll draw that. Now this is the outer fibrous layer. So we can draw that. That is the fibrous pericardium. Okay, and then inside the fibrous pericardium we have parietal layer, and inside we have the visceral layer. Okay, right. Now next, the sinus, the space in the pericardium. We have two space. Okay, number one, transverse sinus. Number two, oblique sinus. Now see the diagram. Now in the diagram, now we opened the pericardium and we removed the heart. Okay, so the outer layer, the fibrous pericardium, inner to fibrous pericardium, you are seeing the parietal layer, and inner to that, this is the visceral layer. I am writing as V. I am writing this as V. Okay, right. Now identify the vessels. Now this is our aorta. I am writing as A. Sorry for using short form. So A is aorta. Okay, and this is our pulmonary trunk. Now aorta and the pulmonary trunk, they have a common visceral layer. Why? See, aorta and pulmonary trunk, they are enclosed by the common visceral layer. Why, sir? Why they have a common visceral layer covering? Now developmentally, aorta and pulmonary trunk, they are coming from common origin, truncus arteriosus. That is why they have a common visceral layer of serous pericardium. Similarly, see the veins. Now the superior vena cava, inferior vena cava and pulmonary veins. The veins have a common visceral layer. Okay, right. Same reason. Now, we are seeing one space. I am shading here. Now, see between aorta and pulmonary trunk and behind superior vena cava, we are seeing this space, and that space is called transverse sinus. So what is transverse sinus? See, transverse sinus, listen, we will write the points. Now listen. So transverse sinus, it is a space between the two tubular reflections of the serous layer. Now what are the tubular reflections? One tubular reflection for aorta and pulmonary trunk. Another tubular reflection for superior vena cava. So between the two tubular reflections of serous layer, we are seeing one space. That space is transverse, and that is called transverse sinus. Clear? So now we're going to write transverse sinus. So transverse sinus, please write It is a space between the two tubular reflections of which layer? Visceral layer of the serous pericardium. Okay, right. Now, what is a boundary? Now, in the front side, anteriorly, what we have? Vessels, our aorta and pulmonary trunk. Okay, behind, superior vena cava. And below, our left atrium. This is the boundary for the transverse sinus. Now, what is the significance? What is the surgical importance of transverse sinus? We can ligate the aorta and pulmonary trunk through transverse sinus. Ligation of aorta and pulmonary trunk. So, transverse sinus is used to ligate the aorta and the pulmonary trunk. That's all. Okay, shall we proceed? So, this is about the transverse sinus. Next, oblique sinus. Oblique sinus is very simple. Now, see the pulmonary veins. Now, between the two right and left pair of pulmonary veins, we see a space that is called oblique sinus. Okay. So, what is the boundary of oblique sinus? So, oblique sinus boundaries, right side, right pair of pulmonary veins. Right pair of pulmonary veins. Left side, left pair of pulmonary veins. Left pair of pulmonary veins. Okay. Now, in front side, anteriorly, we have left atrium. This is very important. So, in the front of the oblique sinus, we have left atrium. Okay. Again, what is the necessity for the oblique sinus? Now, why we have oblique sinus? Now, behind the oblique sinus, we have esophagus. So, I'm drawing the esophagus in dotted lines. I told you already, any structure, if you draw in dotted lines, that means they are posterior. So, now behind the oblique sinus, we are seeing esophagus. Okay. So, what is the relation? So, we have left atrium. Behind the left atrium, this is anterior. Behind the left atrium, we have oblique sinus. And behind the oblique sinus, we have esophagus. So, esophagus is posterior. So, oblique sinus is behind the left atrium and esophagus is behind the oblique sinus. Clear? Now, I told you why we have oblique sinus. See, oblique sinus, it is giving extra space for the expansion of left atrium. Okay, so oblique sinus is giving some extra space for the expansion of left atrium. Imagine if you don't have oblique sinus. Now, the left atrium expansion compress the esophagus, which in turn result in dysphagia. Yes, that is why we have the oblique sinus. So, oblique sinus is giving extra space for the expansion of left atrium. That's all about the pericardium and the sinus of pericardium. Next, we're going to start the external features of the heart. Yes. Now, in the external features of the heart, now we're going to see the apex, base, right border, left border, inferior border, and two surface, sternoglossal surface and the diaphragmatic surface. Just have some basic idea, that is more than enough. See, nowadays we're not getting any questions from the external features of the heart. Okay. Just have some basic idea, that is more than enough. Now, the apex of the heart. Now, the apex of the heart is formed by, it's very good, left ventricle. Okay. Now, what about the base of the heart? Now, base of the heart is also known as posterior surface. Now, the posterior surface is formed by 2/3 by left atrium and 1/3 by right atrium. So, 2/3 by left atrium and 1/3 by right atrium. Okay, right. That's all about the apex and base. Now, what about the right border? Now, see the anterior view. Now, right border. Now, border we're going to start. Now, see the anterior view of the heart. Now, right border is starting from the opening of superior vena cava to the opening of inferior vena cava. That is our right border. I'm writing as right. Now, who is forming the right border? Right border is formed only by right atrium. So, right border, it is formed only by right atrium. Okay. Now, what about the inferior border? Now, the inferior border starting from the opening of inferior vena cava to the apex of the heart. Okay. So, who is forming the inferior border? I told you from the opening of inferior vena cava to the apex of the heart. So, inferior border is formed by your right ventricle and also by left ventricle. Fine. Now, what about the left border? See, left border, it is starting from the left auricle and up to the apex of the heart. This one. Okay. So, from left auricle up to the apex of the heart. Now, these are the three borders we have. That's all. Next, surface of the heart. Okay. Now, surface, mainly we're going to discuss two surface. The anterior surface and the diaphragmatic surface. The anterior surface, which is also known as sternocostal surface. Sternocostal surface. Now, who is on the sternocostal surface? See, sternocostal surface mainly formed by two ventricles, right ventricle and the left ventricle. We have some more structures. They give a minimal contribution for the sternocostal surface. What are those? The right auricle. This is right atrium, right ventricle, left ventricle. Sorry. This is right auricle. I'm writing as AU. AU means auricle. This is right atrium. This is right ventricle. This is a major contribution. 2/3 by right ventricle and 1/3 by left ventricle and also by left auricle. So please write. The sternocostal surface. Sternocostal surface. So sternocostal surface is formed by right auricle, okay, right atrium, okay, left ventricle 1/3 and also by right auricle. So major contribution by right ventricle and left ventricle. Right. Now what about the diaphragmatic surface? See, diaphragmatic surface is mainly formed by your left ventricle. Okay. So your left ventricle and your right ventricle. Diaphragmatic surface is formed by 2/3 by left ventricle and 1/3 by right ventricle. So these are all the surfaces of the heart. Over. Next, we're going to see some grooves. Just the three grooves and one crux of the heart we see. Now we have anterior interventricular groove. Anterior interventricular groove. Now anterior interventricular groove have anterior interventricular artery and great cardiac vein. Great cardiac vein. So again, in the name itself you have a clue. Anterior interventricular groove that is present between right ventricle and the left ventricle in the front side. Anterior interventricular groove. So what is present? The same artery, anterior interventricular artery and one vein. What vein? Great cardiac vein. Very important. Okay, sir. Next, posterior interventricular groove. Posterior interventricular groove or posterior interventricular sulcus. What is present? Posterior interventricular artery and one vein, middle cardiac vein. Middle cardiac vein. See, everybody knows anterior interventricular artery present in the anterior interventricular groove. Posterior interventricular artery present in the posterior interventricular groove. Everybody knows that. The point is, they'll ask you the vein. Great cardiac vein present in the anterior interventricular groove and middle cardiac vein present in the posterior interventricular groove. That is the question. Okay. Right. Now, one more groove or sulcus we have. That is the coronary sulcus. That is the coronary sulcus. Now, coronary sulcus is also called atrioventricular groove. Again, name itself you have a clue. Atrioventricular groove or atrioventricular sulcus. It is a sulcus or groove present between the atrium and ventricles. Now, what is the structure present in the coronary sulcus or atrioventricular groove? The coronary artery and its branches. The coronary artery and its branches are present in the coronary sulcus. The coronary artery got the name because it is passing in the coronary sulcus. Okay, so coronary artery and its branches passing in the coronary sulcus. Fine, that's all. Now, one more point. Now we have two pulmonary surface, right pulmonary surface and left pulmonary surface. Now, which part of the heart which is related to the right lung? Which part of the heart is related to the left lung, the mediastinal surface? Okay. Now, right lung mediastinal surface is related to right atrium. The right pulmonary surface, it is mainly by right atrium. The left pulmonary surface, it is mainly by left ventricle. So, left pulmonary surface mainly by left ventricle, right pulmonary surface, it is mainly by right atrium. Okay, right. Now, one last point in the external features of the heart is the crux of the heart. So, it's the crux of the heart. Now, crux of the heart, it is a meeting point of three sulcus, three grooves. Now, this is number one. Now, what is number one? Number one is interatrial sulcus or interatrial groove. Okay. Number two. This is number two. What is number two? Number two is present between the atrium and the ventricles. So number two is that is present on the back side. Okay, crux of the heart you see on the back side. So number two is the posterior part of atrioventricular sulcus. Okay, and number three is this one. What is number three? Again, that is present on the back side between the right ventricle and the left ventricle. So it is posterior part of interventricular sulcus. Interventricular sulcus. So the meeting point of these three sulcus or groove is called the crux of the heart. Now we're going to see some basic animations in the heart. Now that is our right auricle. Below that is the right atrium. This is right ventricle. That's right ventricle. And that is our left auricle. And just below that is the left ventricle. Okay, right. Now who will form the apex? The apex is formed by this part only. That is our left ventricle. See my hand that is touching the heart, no? That is the apex. See that part. Now this is the base of the heart. Now the base of the heart is formed by, this is our left atrium and also the right atrium. Major contribution for the base, left atrium only. Now why I am saying left atrium? Because left atrium which is receiving the four pulmonary veins. This vein, this vein, this vein and that vein. You are seeing the four pulmonary veins opening into the left atrium. Okay, that is the base of the heart. Left atrium and the right atrium. Right. Now we are seeing the diaphragmatic surface here. This is a diaphragmatic surface which is mainly formed by our left ventricle and also by our right ventricle. So these two ventricles will form the diaphragmatic surface. Now we're going to see the interior of the right atrium. Now you're seeing right atrium here. Above is a right auricle and below is a right atrium. So now we're going to see the interior of the right atrium. Now right atrium, the posterior wall is very smooth, which receives three veins. I told you. Now above, yes, you are seeing the superior vena cava opening. That one, superior vena cava opening. Now below, this is inferior vena cava opening, and we also have the coronary sinus opening. I'll show you there. See there. Yes, that is our coronary sinus opening. Three veins opening into the right atrium. Superior vena cava, inferior vena cava, and the coronary sinus. Okay, right. Now we're going to see the septal wall. The septal wall. Okay, now this is our fossa ovalis. Now in the margins, you are seeing the limbus fossa ovalis. So fossa ovalis is coming from septum primum. Very good. The limbus fossa ovalis is coming from septum secundum. Okay, right. Now these are the features you are seeing in the posterior wall. Now come to the anterior wall. Now in the anterior wall, yes, you are seeing the rough impressions. The anterior wall is rough. Yes, you are seeing the anterior rough wall that is coming from our primitive atrium. That is the anterior rough part. Okay, right. So now we are seeing the anterior rough part, posterior smooth wall completed. We also come to septed wall. Now last one in the right atrium, we're going to see one triangle. The triangle is called the triangle of Koch. Now that is the base of the septal leaflet, and that is our coronary sinus opening, and that is our tendon of Todaro. Now, if you connect these 3 points, we'll get one triangle. The triangle is called triangle of Koch. Triangle of Koch contains AV node. These are the basic points you have to know about the right atrium. Now, next, we're going to see the interior of the right ventricle. Now, the right ventricle. So, we removed the right ventricle. Now, see here. Now, this is the rough inflow part. The inflow part is very rough, and that is called as trabeculae carneae. And see the outflow part. The outflow part is very smooth. That is coming from conus part. Okay. Now, in the inflow rough part, we are seeing these structures, bridges here. Now, can you see the bridge here? My finger is pointing towards the bridge only. Now, that is our papillary muscle. Okay. So, bridge is extending from the septal wall up to the papillary muscle. So, bridge is called septomarginal trabeculae. So, septomarginal trabeculae, also called as moderator band, which contains the right bundle branch. Okay. Right. This is example for bridges. Now, we also have pillars. So, pillar means the base will be fixed and the apex will be free. Now, the pillars are nothing but our papillary muscles. See here. Now, these are the papillary muscles. Can you see the projection there? Yes. These are the papillary muscles we have. Papillary muscles. So, papillary muscles, the apex of the papillary muscles. Now, can you see the card-like structure attaching to the apex of the papillary muscle? Those are nothing but our chordae tendineae. So, now this is the right ventricle interior. We are seeing 3 papillary muscles. Anterior papillary muscle, posterior papillary muscle, and septal papillary muscle. 3 papillary muscle for the right ventricle, whereas 2 papillary muscle for left ventricle. Okay. Anterior, posterior, and septal. We are seeing the 3 papillary muscles clearly here. These are some basic points we have to know about the right ventricle. So, now we are seeing some pericardium. So, we're going to remove the pericardium. And yes, we're going to remove the fibrous and the serous pericardium. We're removing all this. And after that, yes, we are seeing the blood vessels. Okay. Right. So, now we're going to see the right coronary artery and the left coronary artery. Now, this is our right coronary artery. So, right coronary artery is present, yes, it is descending down between the right atrium and the right ventricle. Between these two, the right coronary artery is descending down. Now, you can see the inferior border clearly there. Okay, that is the inferior border. Now, the right coronary artery which wind around the inferior border and then go to the, the diaphragmatic surface. See here, is winding around the inferior border and which is reaching the crux. Now, in the crux, the right coronary artery anastomosing with the circumflex artery. Now, in the crux, the right coronary artery is giving this branch. Now, can you see this branch here? That is our posterior interventricular artery. Posterior interventricular artery is a branch of our right coronary artery. Now, we're going to see some branches, some main branches we will see. Now, can you see this branch? Now, this branch is our SA nodal artery. It was seen here. Yes, this is SA nodal artery. Okay. So, SA nodal artery, 65% of the cases, it is coming from right coronary. 35% of cases, it is coming from circumflex artery. Right. Now, you are seeing the numerous branches. Now, these branches are nothing but right anterior ventricular rami. One branch will be long enough to reach up to the apex. Now, that branch is called as the right marginal artery, also known as acute marginal artery. Next, we're going to see the left coronary artery. The left coronary artery divided into anterior interventricular artery and the circumflex artery. Okay. Now, we are rotating and we are seeing the heart. Now, this is the anterior interventricular artery. Yes. Now, we are seeing one small branch here that is called as diagonal artery. So, diagonal artery, yes, that is a branch from our anterior interventricular artery. This diagonal branch supplies the, left ventricle. Now, can you see this branch? That branch is called as circumflex artery. Now, circumflex artery, branch of left coronary. Circumflex artery is giving this branch. You are seeing the branch clearly there. Now, this branch is our left marginal artery, otherwise known as obtuse marginal artery. Now, these are the arteries we are seeing in this animations. Now, we are adding the veins here. Right. Now, first we are seeing the great cardiac vein. See here the blue color, that is the great cardiac vein. Now, great cardiac vein accompanying the anterior interventricular artery and the circumflex artery. The great cardiac vein accompanies 2 arteries. Okay. Now, the great cardiac vein, which in turn continue as the coronary sinus. Okay. Now the coronary sinus, which in turn opens into the right atrium. See there? You are seeing the continuation of the coronary sinus that is opening into the right atrium. Right atrium, which wall of right atrium? Just now I told you, posterior smooth wall of the right atrium. See there? You are seeing the opening there. That is a posterior smooth wall of right atrium. Can you see that? Can you see that? There is a posterior smooth wall of right atrium receiving the coronary sinus. Right. Now, what are the tributaries? Remember, tributaries are, now this one, this is our middle cardiac vein accompanying the posterior interventricular artery. Okay. And we are seeing these tributaries. These are nothing but the small cardiac vein. These are the small cardiac vein. Okay. Small cardiac vein accompanying the right coronary artery. These are some tributaries you can see in this animation. Okay. Right. So that's all about the external features of the heart.